A man is as old as his arteries. It's a statement made in 16th century itself by renowned physician Dr. Thomas. So what is the link between artery and the life itself? So arteries are a tube which has a lumen and it is elastic, and these arteries are present everywhere in the body. So it is very important and vital for these arteries to carry the blood supply, which is high in nutrition and oxygen, and take it to all part of our body, from the organ to tissue to cell. So without these arteries, blood flow cannot be restored to all the part of our body. Now, what is this? Arteries are related to heart disease. Now, if you think when you are young, these arteries are elastic, and as we get old, these arteries become harder and become a stiff vessels. So the difference between young and old internally, what we call as a biological clock, it's only the difference between the stiffness of the artery when you are young and when you are aged. So how the artery function and how it is important for your life. So everyone knows arteries are important because it carries the blood. So when you look at the body, these arteries can be classified into many types. Some of them are called as elastic arteries, some of them are muscular, and then smaller vessels, microvessel, and into capillaries. So if you take all these arteries and stretch them into a single thin line, or stretch them into a straight line, it will cover 60,000 miles. So large are our arteries to cover our entire body. Now, if these arteries get stiffer and stiffer, definitely it is going to impact our life itself. So most of the cardiac risk factors we discuss about, whether it is a hypertension or it's a diabetes, or sometimes it is a high cholesterol level, smoking or obesity, all these are linked to the arterial stiffness, and this arterial stiffness is a link between heart disease and cardiovascular risk factor. So how does naturally these arteries work? So if you think your heart is a pumping organ. It's a pumping station present in the upper part of the body. So it has to pump constantly from the day you are born to the day you die. And when it pumps constantly, the blood is pushed into these arteries, and these arteries carries the blood supply to all part of our body. Now, when your heart pumps, it pumps in contraction and relaxation. So contraction is called systole and relaxation of the heart is called diastole. Now look at how the nature has designed your arteries. Your arteries are not a pipe, it's actually an elastic tube. So when the heart contracts, it pushes the blood into the higher velocity, pressure, and it is push the volume into the blood vessel. So when it goes to the blood vessel, these blood vessels are elastic, as I said before. So what happens? When the blood enters the artery, the vessel dilates. And when the heart relaxes, the pressure falls. But that time, the vessels also constrict, because the enlarged vessel is going to come to its original position. When it does, it pushes the blood forward. So this pulsatile contraction of the heart is not felt into the periphery of your body vascular system, because this pulsatile is converted into steady flow of blood because of your main elastic vessels, aorta and other muscular arteries, which are all very elastic. Now think about this scenario. As you get aged, your vessel, I purposely said age because age is one of the powerful predictor of your heart disease. So as you get age, your chances of getting heart disease, stroke, renal failure naturally increases. But with your age, if you also have the cardiac risk factors, which I said now, your diabetes, hypertension, smoking, all these risk factors are present, then it accelerates your aging. So your blood vessel is not going to see your chronological age. Chronological age means if I get your date of birth, I can tell your age. But your body is not going to look at your chronological age, but it is going to look at your biological age. So your biological age depends upon your stiffness. That is why even in 16th century, they made this statement: the man is as long as his arteries. So if your arteries get stiffer, your chance of getting heart attack, everything goes up significantly higher. Now, When this vessel gets stiff now what happens is the heart is trying to push the blood. Now the vessels are not dilating when the heart is contracting. So when the vessels are not able to dilate, the pressure rises up within the vessel. So this is why the pressure goes up as you get age. And now the periphery vessels, as I said, some of the small micro vessels or capillaries which is present in your vital organs, in your brain, in your kidney, your lungs, your liver, everywhere. These micro vessels are very, I would say thin. The vessel wall are very thin, and usually they are not exposed to high pressure. But because of your vessels are getting stiff, now these smaller vessels are also exposed to the high pressure. The pulsatile pressure of the heart, which was never felt in this periphery, now the periphery vessels started seeing this pulsatile high pressure. Now what happens is they started to bleed. Because of the high pressure, the vessel wall get ruptured since it's thin, and now the bleeding starts happen. When this bleeding starts happen in your brain, which is called stroke, then if it happens in your kidney, it will lead to renal failure. If it happens in your eye, which we call as diabetic retinopathy, retinal bleeding also causes blindness. So all these things are linked to the simple pressure because your arteries are getting stiffer and stiffer. That is why modern medicine aggressively manage elderly patient with drugs which to reduce your blood pressure. So naturally, since we have longevity of life is increased because of modern medicine, people tend to live longer. So when they tend to live longer, then these type of drugs that to prevent the increased pressure in the periphery is very important. So you can able to reduce the chances of bleeding. But remember, it is only a benefit versus risk. If you significantly reduce your blood pressure, then the blood flow which is supposed to go to the periphery cannot happen. Then it lead to lack of blood flow. That also causes renal failure, stroke, and other complications. So it's a balance. How much pressure should be reduced when you are in the aged. So this is a very important aspect of arteries as a important tool in predicting the heart disease or vascular disease. Now, how would I prevent my vessel become stiff? Now you can talk about lot of supplements. They talk about giving nitric oxide, L-arginine supplements, or some fruits which have high in antioxidant. These are all have impact and prevent your vessel become stiffer. But remember, the best and simple process which can able to reduce your stiffness is number 1, regular exercise. Number 2, it's weight reduction. These two things have enormous impact on your vessel wall. So if these two things can be achieved, then your vascular aging can be slowed down. The progression of the aging, which is called the biological aging, can be definitely slowed down. Now, in heart disease patients, we all know they have to walk regularly, but in a slow walking phase. You cannot push a cardiac patient to walk faster. But the same 45 minutes per day walking cannot be applicable when you are talking about wellness. Because wellness are young people who wants to be avoid getting disease. It's not getting disease and reversing back to normal. It is a principle of preventing the patient to have the disease or stiffness of the artery. So any program to design reversal of aging in a wellness program should include exercise and weight reduction. And third, it's what we are going to introduce into the wellness clinic called EECP, Enhanced External Counter Pulsation. Now what this therapy does is restore the blood flow into the body similar to an aggressive exercise. If even a people who are on the wellness clinic are asked to do an exercise which could be acceptable to your body to reverse the aging, that exercise capacity is much more than what they can achieve by themselves. So to assist them, we do this EECP in healthy people to restore the vascular health and prevent them getting cardiovascular disease in the future. So by doing EECP, what it does is we place the cuff in the lower limb and compress the vessel and relax the vessel. So the compression and the relaxation of the vessels happens in your lower body. So if you look at your leg, 60% of your blood vessels are in the lower limb because we are erect and we are walking. So most of the blood supply is there at the lower limb. So when we do EECP, compress and relax, we stimulate the natural way how your vessel contract and relaxes. So this is synchronized with your heart. So when your heart is pumping, with high force and pushing the blood into your blood vessels or arteries, the cuff deflates so that it can able to dilate the vessel. And when the heart is able to dilate so that the pressure falls everywhere, this EECP, what we do at that time, we compress the vessel so that the blood is pushed in the forward direction, mimicking the natural way. But when I say the natural way, it can be achieved only by the higher level of exercise. This higher level of exercise, people are not normally adaptable to this level of exertion because of the poor exercise capacity. So what we mean to say is EECP can able to stimulate a higher level of exercise which these people can never do on their own, so that restore the blood flow across your blood vascular system in a higher velocity, pressure and higher volume. So this is what EECP can able to reduce the arterial stiffness or reverse the aging process itself. So the aging process here means your vessel becoming stiffer and stiffer. By doing EECP, this vessel stiffness can be reversed back into normal. Now, let's discuss about what is the functioning of the artery which is reversed by exercise or EECP. So, initially we said stiffening of the artery and why this arteries get stiffer naturally. Now, if you take the blood vessels inside are lined by a thin layer of cells, and these cells are called endothelial cells. These endothelial cells are very important and it acts as a sensor. It is a sensor which is placed inside the vascular system and can able to detect the blood flow, velocity and pressure. Now, if your blood flow is going on a faster way, it means it creates a shear stress. The shear stress is what the blood flow will rubbing against this endothelial cell. When the blood flow with a higher velocity rubs the endothelial cell, now what the nature has given is this endothelial cell will secrete what we call as a nitric oxide. This nitric oxide is a signaling molecule which has many more important function, preventing the arteries getting stiff. At the same time, if you are a sedentary with obesity, lack of exercise, and if your blood flow is going to be in a lower velocity, we call as stasis, then what happens? It is going to stimulate the endothelium in a bad way because there is no shear stress as if when you're doing an exercise. So when there is a lack of shear stress, what it comes is these endothelial cells are not stimulated and eventually this endothelial cell will become dysfunctional. This is what we call as endothelial dysfunction. When this endothelial cell become dysfunctional, then it going to secrete some hormone, and this hormone which is called endothelin will make your vessel to constrict and become stiffer. So the flow, that's what we call as a life. The life flow is a blood, and the blood velocity is what it is going to determine whether your vessel is going to become stiff or is it going to become elastic. Now, you remember, you have lot of cardiac risk factor. You might know about smoking is bad, obesity is bad, central adiposity is bad, having a high blood pressure is bad, having a glucose level high is bad, which is diabetes, and sometimes even having a high cholesterol is bad. Now, why it is all bad? And remember, when your endothelial become dysfunctional because of lack of exercise, your blood is moving slower and endothelial cell is not stimulated, and because of that it is getting dysfunctional. At that moment of time, your vessel become very sensitive. So before, if you are doing exercise, even if you have a high cholesterol, somehow this cholesterol is not getting into the blood vessel. But when you have an endothelial dysfunction, now this high cholesterol can easily find a way inside the cell because of the disrupted vessel wall. and go and stay there inside the vessel, which we call plaque. And also there are a lot of chemical cascade is stimulated, which makes the platelet, which is what is important for clotting, go and get stick to this vessel wall, which forms thrombus. And also it create inflammation, and all these things make your vessel stiff, and also a precursor to form blockage, which we call atherosclerosis. So all these things happen because of the flow is not normal. So by doing EECP, even if you are with the cardiac risk factors, this accelerated flow of blood can reverse your endothelial function and make sure this nitric oxide is secreted enough into your circulation, preventing you from the adverse effect of high cholesterol, high pressure and diabetes. So this is a very important aspect of EECP when we are using in the wellness clinic. So we measure all this risk factor before and after EECP, and also train you to do continuously EECP for 20 to 35 days along with exercise. So all these things, if you can properly done, it can actually reverse your vascular aging, which is what it's called the real anti-aging in medicine.